So CAR T in CLL is, I think, is an emerging story. In fact, one of the first trials which was reported back around 10, 11 years ago from University of Pennsylvania was actually in patients with CLL. That was, I think, 2010 or 2011 timeframe. But since then, the development of CAR T in CLL lagged behind, in part because around the same time, drugs such as ibrutinib, drugs such as venetoclax, and other drugs such as more recently acalabrutinib, zanubrutinib were coming along, and these drugs really changed how we manage patients with CLL. So there was felt to be less of a need in CLL, and from a pharmaceutical company standpoint, from the investigator standpoint, a lot of effort was spent on DLBCL and ALL and multiple myeloma. But now I think there's a renewed interest because we are seeing patients who have failed a BCL2 inhibitor, who have failed a BTK inhibitor, their CLL has seen few lines of therapy, and we're looking for new targeted approaches for those patients. So in that regard, I think CAR T is coming into town to say, there are more and more trials being done. The largest trial for CAR T in CLL is with the product called liso-cel, which was presented recently and published as well in the journal Lancet, where the investigators showed that in multiply relapsed refractory CLL, when they gave single infusion of liso-cel CAR T, about half of the patients became MRD negative, and then the average duration of remission was about 12 months. So I think it is certainly showing activity in this heavily pretreated patient population. I think we'll have to see eventually how the FDA will look at it in terms of the approval strategy. But at the same time, as has been happening in other B-cell malignancy fields such as ALL and lymphomas, there are other CAR T constructs which are in clinical trials right now, including patients with CLL, and we want to see how that data matures for these patients.